Jay Angoff is on the line with us. He's a partner with Marian Scalet. Am I saying that right, PLCC?
No, close. It's Marian Scalet.
Mary and Scalet. Thank you very much, Jay. And former director of the Office of Consumer Information and Insurance Oversight at DHS, appointed by HHS Secretary, at the Department of Health and Human Services, HHS, appointed by HHS Secretary Kathleen Sebelius, and the website findjustice.org. And Jay, you are quite familiar with these health exchanges that are part of Obamacare or the Affordable Care Act. And if my reading is correct, last Friday was the deadline for individual states to either set up their own exchanges or tell the federal government to come in and take it over for them, do the job for them. Do I have that right?
Yes, exactly right.
Okay, and so what happened on Friday?
Well, on Friday, a few states said that they would be doing partnership exchanges with the federal government, and that means that the federal government will be responsible for certain functions and the states for others. Although the federal government will be running the exchanges in the majority of states, about 17 will be running the exchanges themselves, and then in the rest of the states, there'll be a partnership between the federal government and the state. But the important thing is that in all states, regardless of whether the federal government runs it or the state runs it, or there's a combination of both, there are going to be these exchanges, which means that people are going to be able to go to the Internet. They're going to be able to punch in the answers to 4 different questions, which are where you live, your zip code, basically, your age, the type of coverage you want, and whether you smoke or not. That's also a rating factor. But when you punch in the answers to those questions, you will get the prices charged by all the insurance companies doing business through the exchange in that state, and you'll be able to compare the prices of policies that are of similar value. So for the first time, people will actually be able to make apples-to-apples comparisons of insurance policies, and that will facilitate price competition and should drive down rates.
That's remarkable. It's also interesting that while insurance companies can no longer discriminate based on prior conditions, they can't say if you ever had cancer or if you ever had hepatitis or if you ever had, fill in the blank. They can say, do you smoke? That being addicted to nicotine is a discriminatable offense, as it were.
Yeah, and that's an interesting issue, and that's an issue on which I guess reasonable people can disagree, but both the health advocacy groups and the insurance industry were in favor of allowing companies to charge people more based on smoking.
Sure.
Insurance companies, obviously, for risk-related reasons. People who smoke have a much higher risk of illness, of costing insurance companies money, so they want to be able to charge people who smoke more. And then health advocacy groups also think that that's a good thing. It's a good thing for the health status of the country. So
might be the thing that'll push some smokers over the edge and cause them to say, "Okay, enough already."
Exactly.
But now, Jay,
one more reason not to smoke.
Right, there you go. As if we needed any more. Jay, correct me if I'm wrong, but my understanding is that by and large, and there may be a few exceptions to this, but by and large, the states that have opted to create their own in-state insurance exchanges are states that are basically blue states run by Democratic administrations. And the states that have chosen to say to the federal government, you guys run it, have been largely red states or even blue states states that are run by Republican governors and Republican legislatures. Do I have that right?
Yeah, and that's ironic, isn't it?
Well, I think it's bizarre because the whole Republican talking point is states' rights, that the states should be able to do things. And so here you have Obama saying, cool, you want to do it? Do it. Set it up. Run it yourself. And these Republican governors are saying, no, we're not going to play. After all, this is your game.
Well, you're absolutely right. It is. I think I used the word ironic. You said bizarre. I think they're both apt. What you've got is Republican governors, very conservative, very anti-Obamacare and anti-Obama governors saying, welcome federal government. They're
Right.
inviting the federal government in. They want the federal government to run the exchange. And of course, that's completely inconsistent with all the rhetoric that we hear from these governors. So it doesn't make sense.
What impact is that going to have on those states? Is that going to diminish? I mean, is there an incentive to states running their own exchanges? Does it improve the quality of the product ultimately that their citizens get, or
not necessarily? That's a great question, and the answer is not necessarily. But to the question whether there's an advantage for states in running their own exchanges, the answer to that is very definitely yes. The advantage for states is that they get money if they run their own exchanges. There is a program, there's a provision of the Affordable Care Act which authorizes the Department of Health and Human Services to make grants to states that run their own exchanges to pay the cost of running their exchanges.
Right.
And so that's a tremendous benefit to states. But some of them, and in a way, in a perverse way, maybe we should give some of these governors credit for it. Some of these governors have said, no, we don't want the money. Some governors have actually given back the money.
Mm-hmm.
But again, all this stuff is sort of inside the beltway. As far as the individual is concerned, the individual, wherever he or she lives, whatever state, there will be an exchange, and in each state, people will be able to go to the internet, punch in the answers to a few questions, and get quotes for the same value policies sold by many different.
Will they also be able to punch in their income and the size of their family and find out how much of the cost of their health insurance will be picked up by the federal or state government as a consequence of Obamacare?
Absolutely, and rates are going to differ by family size. Obviously, if you buy insurance as an individual,
so that's all built into the rate then.
That's right. There'll be separate rates for individuals and for families, and then as you pointed out, yes, people who earn less than 400% of the poverty level will be subsidized, and that subsidy
would be about $75,000 a year, $80,000.
The average is about $5,000 a year, but the average varies greatly. If you're close to 400% of the poverty level, which for a family of four is about $90,000, if you're close to that, you'll get a very small subsidy. But then that subsidy increases as you get closer to 133% of the poverty level, and then below 133% of the poverty level. Again, this depends on whether the governors accept this, but the Affordable Care Act provides that Medicaid can be expanded for anyone up to 133% of the poverty level. And in that case, people who make less than that will automatically qualify for Medicaid and will be able to enroll in Medicaid through the exchange. And
get basically free single-payer health insurance if you're making less than would that be about in the neighborhood of $20,000 a year?
Well, that's exactly right.
Basically minimum wage.
Single-payer is a dirty word to some of our friends who are governors in these red states. So listen, this is even more bizarre than the position that they've taken on the exchanges. For the Medicaid expansion, the federal government pays 100% of the cost for the first 3 years, and then thereafter the states must pay a couple of percent, and then beginning in 2020 they pay 10%, but the federal government continues to pay 90%.
Right.
So over the long run, at very worst, the states get back $9 for each dollar that they put in. They get back $9 from the federal government. And for the first 3 years, it's 100% paid by the federal government.
And yet still you have some Republican governors who are saying, ain't going to take the money.
We're not going to take the money.
Right.
We prefer to have our people uninsured.
Right.
Even
That's
though
bizarre.
the federal government will pay, we want our people to stay uninsured. And not only that, but we'll have our taxpayers in our state pay federal taxes to insure people in other states. So it's completely bizarre. And what makes it the most bizarre is the states that have the highest rate of uninsured, like Texas, for example, they're the ones who've been the most aggressive in saying they're not going to take the Medicaid money.
Yeah, this is all political posturing, and I have a feeling over the next couple of years it'll shake out, but we'll see. Jay Angoff, FindJustice.com. Thank you, Jay.
Hey, thank you.
For illuminating us. I appreciate it.